The following is a presentation for mental health and substance use, a call to action. The purpose is in fulfillment of NSG 548 assignment, in which an assessment was completed with population health data derived from local and state statistics. Based on the data, I've chosen to incorporate mental health and substance use as a population of interest. This is a vulnerable population because they have underlying social determinants of health, creating barriers to healthcare, access to basic needs, and negatively impacting quality committee indicators. Information regarding the health, social, political, ethical, and economic benefits of interventions will be discussed, as well as nursing and advanced nursing roles um, in this issue. The author states that additional community focus and support on behavioral health or mental health and substance use is needed within Colorado, and with the focus on the community of Pueblo, mitigation of the negative health impact it poses at the local and state levels for vulnerable populations. So to begin, this is an overview of mental health. So mental health is defined as a state of well-being in which each individual is able to realize his or her own potential, cope with the normal stresses of life, work productively, and make the contribution to the community. Mental illness is what we're more familiar with, describes all psychiatric disorders that have a definable diagnosis disease. This is typically what you would find in the DSM-5. Now, mental illness is related to developmental, biological, or psychological disturbances and mental functioning. The ability to think may be impaired, as you would see in Alzheimer's. Emotions may be affected, as would be seen in major depression. Or there would be behavioral alterations that may be seen in schizophrenia. Or there could be a combination of the three. Contributing factors to mental illness, um, specifically severity and progression of a disorder, may be affected by inborn characteristics, biological genetic factors, social and economic circumstances, and environmental factors. And as we move on, we'll discuss how we may be able to impact these social and economic circumstances, including the environmental ones. Similarly, substance use disorders have similar contributing factors. But to define this, it's the use of psychoactive chemicals or substances that can enter the body via various routes. Now, substance use disorders is the pathological use of substances that results in impaired control, social impairment, risky use, and physical effects. Addiction, which can be used interchangeably with substance use disorders, is the behavioral component associated with it, which is considered disease of dysregulation with the reward, motivation, memory, and circuitry pathways of the brain. Social determinants of health. This is categorized into the 5 domains that you see over here into the right corner. These conditions can contribute to a wide array of health disparities and inequities, which is why Healthy People 23 asserts that public health organizations and their partners in sectors like education, transportation, and housing need to take action to improve the conditions in people's environments. So, on the bottom we have a couple of examples, such as the safe housing, transportation, and neighborhoods, working towards mitigating racism, discrimination, violence, improving education, job opportunities, and income, improving access to nutritious food and physical activity opportunities, helping reduce polluted air and water, and then also advocating for increased language and literacy skills. And these are all incorporated in ways to help ensure equity and people are able to reduce their health disparities. So for this issue, defining the problem can be considered from both the state and local level. It's pretty interesting. In 2019, 15.3% of Coloradans reported poor mental health. This increase could signal worsening mental health. A lot of this has been contributed to the COVID-19 pandemic and a lot of other issues that kind of came from that. But what we do see from the state level is concerning statistics regarding mental health issues. Um, and people reporting more mental health issues compared to previous years. And then also we see that with our drug overdose deaths, intravenous drug use, and then also the diagnosis they may receive from IV drug use, such as HIV or hepatitis C. At the local level, Pueblo comparing itself to the state, we can actually see that Pueblo has a higher level of psychiatric ED visits, hospitalizations, overdoses for ER visits, overdoses and deaths, populations reporting anxiety and depression diagnoses, and poor rates of medications being prescribed or visits for their mental emotional health issues. Um, Pueblo, while it is not the worst county within the state of Colorado, it certainly is one of the bigger ones that would be a great case study in showing prevention efforts and call to action, which we'll further discuss. This slide provides additional statistical data regarding what we just discussed here for Pueblo versus Colorado, the suicide death rates, hospitalizations, and such. Defining the problem. So what we see is that there's increased homelessness and incarceration with this issue. Poor mental health is associated with worse educational outcomes. It's a big contributor to Social Security disability, which everyone pays out into. It can extend and affect future generations when you have parents with these poor emotional issues and they're unable to properly care for their children. This further progresses on, almost like an inheritance of such. And then also we have increased rates of substance abuse and deaths by suicide with these issues. Vulnerable populations, which we see for adults, would be those experiencing homelessness and insecure housing, socioeconomic and educational disadvantages, those with severe disabilities or mental illness, and then those individuals involved with the criminal system or have a history of sexual offense. Our behavioral health system here in the Colorado, according to um, the Colorado Health Institute looking at this issue, is that we have fragmented, uncoordinated prevention efforts, meaning that while we may have funds or we may have ways to help produce interventions, we don't work together necessarily to help ensure that it's very effective. In addition, we have administrative burden, which is the federal and state regulations and how they dictate how services can be provided. Sometimes this can create obstacles in itself, not and including that include the paperwork, that include the process for getting individuals access to care. There are workforce shortages across the U.S. and in Colorado, and this is typically can become from for behavioral specifically is lower salaries in certain domains within behavioral health. Also, there is difficulty in getting access or having capacity for workers in rural and frontier communities. Lastly, while there are parity laws that help try to ensure that mental health is given um, or treated the same as physical health, coverage and payment for reimbursement is not the same, and this has created obstacles for individuals having to either pay out of pocket or just not get the coverage that they need for services. And then there's a lack of integrated care, meaning that we're not getting behavioral health and physical health together. Solutions to address this issue: improve mental health treatment affordability, and this could be expanding coverage or improving parity laws, improving behavioral health care capacity, such as doing loan repayment, scholarships, and training programs to incentivize behavioral health. Also, increasing the provider payment and reimbursement rates, which would ensure that providers are able to promote their practices and treat patients that they need to and not lose out on that. And then also increasing preventative services, such as improving screening and partnerships within communities and building community support and resources, which will be further discussed in the call of action. Benefits of enacting these solutions: we can reduce homelessness and incarceration, improve mental health, even attributes, individualized. We can improve educational outcomes. We can mitigate economic costs related to both mental health and substance use issues. There can be decreased rates of substance use overdoses and deaths, and then also it can improve community resilience and health outcomes. Now, oppositions to supporting or focusing this call of action. This would likely be individuals or groups who are uncertain about the problem's significance, meaning that they don't believe this is the biggest issue or contributor or focus that needs to be dealt with at the time. There certainly are a lot of issues that came from COVID-19. However, this is a really, really big, significant one that I would fully support. Additionally, they may be opposed to financial or community focus, and that ties into the first point. Lastly, there may be opposition to aspects of treatment and prevention. For instance, some individuals may not be agreeable with needle exchange programs or medication assisted treatment, where they feel that or individuals who promote these practices are feeding into the issue rather than helping treat or support individuals. However, when we think about supporting behavioral health, this is an all hands on deck issue. There needs to be federal support. There needs to be state governmental agencies on board and community and local governments, resources, individuals, groups, anything and everything, I would say. This picture that we have here comes from the Substance Use Response Ecosystem, which is from a local group here in Pueblo that is supported by the Pueblo Department of Public Health and Environment. These are a lot of, or these are the participants who assist them in substance use preventative efforts. So the community and stakeholders and supports would be health services for mental health and substance abuse, which are some of the ones that were previously mentioned in the last slide. There would be social support networks, and then also there would be education and resources. And all of these can be helped expanded upon. All these can find additional resources or funding to help improve their efforts as well. So nursing and APRN's roles. So we kind of find that nursing and APRNs can focus on the basic prevention interventions, which falls into primary prevention, secondary, and tertiary, meaning they can help try to either reduce the problem from becoming an issue at all by supporting the individuals or the community, finding the issue as soon as they can before health or anything or any other issues come from either the mental health or substance use disorder, or tertiary prevention, which there is an established disorder, but how can we treat it and how can we promote the individual and prevent any additional loss of health and functioning. Now, the capacity for nursing and APRNs, they can help support educational programs, do additional community outreach, behavioral health trainings, and support the role in itself within behavioral health. Additionally, APRNs have the ability to diagnose, treat, and evaluate behavioral health needs. They can also prescribe MAT regimens such as Suboxone, or they can also help promote integrated care into the practice, which has been a major issue in our behavioral health system. This last slide is a letter to the Colorado Board of Health and affiliates, specifically to the Colorado Board of Health, as they are able to appoint members for specific executive bills. They are able to help garner additional support and establishment of funding at the state level, which can trickle down all the way down to local needs. There's a Board of Health within Pueblo as well, which was initially chosen. However, I decided that at the state level, this would help garner a little bit more support and also additional funding efforts as well. This last slide includes my references, and I want to thank you for listening to this slide and this call of action.